Welcome back to the program. Now, not many people realize that when you lose a permanent tooth, the socket that's left behind in your jawbone will heal, but it won't grow back to its original dimension unless you do something about it.
So in other words, you kind of have a hole left behind. So if you don't, the bone is lost, and when you finally want to get a dental implant later, you may not actually have enough bone to anchor it and may need to surgically graft more bone in to anchor it.
But this surgery may no longer be necessary because of a new device that helps the bone to regenerate by itself. So in studio to talk about this particular device is Victor Lee, founder and chairman of BioScaffold International, and that is the company that developed it, along with Assistant Professor Victor Fan, consultant from the Department of Oral and Maxillofacial Surgery at the National University Hospital in Singapore.
Good morning, gentlemen.
Both gentlemen.
Good morning.
So let's talk about this little device that we have here. What is it exactly called?
The chemical, the name is called polylactide glycolic acid. It is commonly used in dissolvers stitches in the body.
Right.
So the material itself is FDA approved. It's very safe.
Okay, so this particular thing is inserted into the socket that's left behind by the permanent tooth, which will then help regenerate bone growth, right?
So what you're really saying is that this little thing here helps sort of serve as a bridge, right? Okay, sorry, I think we're just getting told that actually, because we're talking about India's space launch, that's just coming in right now. We'll come back to the interview just very shortly, but let's cross over to the eastern coast.
Well, this particular launch has a lot of significance to India. We'll monitor that and also go deeper into that topic a little later. But back to our...
That's right. Let's come back down to earth, so to speak. Quite literally. Gentlemen, thank you. Sorry for that interruption. We had to... I mean, groundbreaking, so we had to go and take a look at that. But we were talking earlier about, of course, this... where have we put it? The scaffold that we've talked about to help bridge between teeth. So what you're literally putting there is sort of, as I mentioned, it's a bridge, right? To kind of give the gums, the bones, maybe Dr. Fan, you can tell us something to grasp onto so that they can regenerate. Is that right?
Yes. Basically, as you mentioned earlier on, when someone has lost a tooth, the functional stimulus that the tooth often gives us, where we normally chew and bite, is gone. So bone tends to resorb. So as is on its own, after removal of the tooth, the bone itself will sort of thin down. Just like any bone in the body, we talked about space just now earlier on. If a person in space have lost the functional stimulus of gravity, will lose bone, and that's a problem in astronauts. So the same process happens here. In this instance, where we have the scaffold, after removal of the tooth, we put it into the socket. It will help to prevent the collapse of the tissues around it. It helps to regenerate the bone back to its normal level.
But is there any concern about the acceptance of this foreign material into your body?
No.
This is a common product used for stitches. So it has been in the market for 30 years, material itself. So it's very safe. The technology we have developed is actually a scaffold for general terms called guided tissue engineering.
Right.
So basically when you put into the socket, you will help the bone to heal with the support of the scaffold into new bone.
Right. So, does it stay in you for a long time, or does it, disappear after a while?
Actually, we have did the lab test. It will degrade after 3 months to 6 months.
Okay.
So while it degrades, the bone heal back, which is very fundamental. Yeah, there's very interesting technology behind it. You notice the scaffold is very porous. Yeah,
right.
That's a must because for tissue to grow into the area, you need that space. So we have something called macroporosity, which is very crucial.
I mean, we just got some images now on screen of how you would use this scaffold to sort of bridge the teeth. It's I gotta ask, is it a painful process? I guess you'll be under anesthesia at the time, right? So.
Basically, the way this has been developed is that up to now, when people want to preserve the bone after extraction, it's not really commonly practiced in Singapore, but certainly in the United States, a lot of dentists are doing that now. The present so-called socket preservation techniques involve a surgery, actually. You need to cut open the gums, pack in some material, put a membrane over, and stitch it over, right? So in this instance here, when we developed the scaffold, we wanted it to be as non-surgical as possible. So what we have to do is just simply, after the extraction, put a scaffold at the top part of the socket.
Right.
And as you can see in the sort of a diagram, it actually just do a little simple stitch to cover up. So there's no surgery involved.
Okay. So how does this compare to what was previously done prior to this invention? I mean, how much does this cut down the recovery time, the surgical time?
Certainly. As I mentioned earlier on, there's no surgery involved. It's essentially pulling out a tooth, putting in a scaffold in, and a stitch across in case, just in case you would drop out, but it doesn't normally.
Is the timing of the introduction of this material into the hole crucial, as in immediately after extraction you need to put it in, or do you have like a time period where, let's say I lost my tooth a week ago, does this still help me?
Yeah, that's a very good question actually. Yes, essentially the plan for this is to actually immediately after the extraction put in. But even at a week or so down the line where the clot hasn't been so-called fully organized, it's still possible. But if you're talking of people who have lost the teeth, the bone has already grown over, then it's a different process altogether.
Okay.
Well, Victor, let me ask you, I mean, has this scaffold been used in other procedures? Because it sounds like, I mean, if it can be done for teeth, I'm sure it can be done for many other parts of the body where we need to, have something to help fill the void between the ligaments or the joints or things like that.
Yeah, it's a good question. Yeah, I mean, in fact, this scaffold application for our leg socket repair is only the first step. Our technology can be extended into other areas like the plastic surgery, cranial repair. Of course, currently we are only targeting at this special areas called dissolvable scaffold.
Right.
But we also have the long run that coming out porous titanium scaffold, which can actually will be much more cost effective and better for human usage. Yeah.
Well, you said cost effective. Now I'm wondering how expensive though is it? I mean, what's the cost? Is it more expensive than the conventional teeth implants?
Yeah, unfortunately we are running at a so-called low production rate at the moment. So our price still on so-called affordable area, but we intend to actually bring the price down in the long run when we can fully automate the process so that everybody can enjoy the benefit of using the scaffold.
Can you give us a ballpark range as to how much it would cost?
Currently, I think the dentist will charge between probably about 100 to 300, depending on where the dentist is. Singapore dollars.
Just for this scaffold?
Yeah.
Okay.
Yeah.
Okay. Well, I guess, I mean, hey, if you've got a hole in your teeth, it's not too much to pay. I mean,
Right. And I presume that everybody is eligible for this, right?
Yeah, I mean, it's
no side effects. No, you don't have to be.
It's biocompatible, as Victor has mentioned earlier on. This is actually a material called PLGA, which is used in dissolvable sutures. The same material exactly that has been into the human body for a long time now, so no side effects. Yeah.
Well, thank you, gentlemen, for coming in. I've opened the cap to just show our viewers how small it is.
Yeah,
it's like,
it's really. I don't know if we can get that, but.
Yeah. We were holding this up. This is just a casing.
Yeah.
This is how small it is.
And just give you an example here. Let me slip this in next to her. This is how it is in the.
That's right.
You see right here. This is a tooth. You can't really see it, but that little thing is in there. So it makes sense. It has to be smaller than your tooth, right?
Yeah, of course. Amazing what little things could do for you. Thank you so much for coming in this morning. That was Victor Lee, founder and chairman of Bioscaffold International, and also assistant professor Victor Fan from the Department of Oral and Maxillofacial Surgery at National University Hospital in Singapore.
And we're going to take up a quick break. Keep it right here on Part-Time Morning. Back in a bit.